We'll, in fact, now talk about what is going on in terms of the COVID-19 pandemic in the country. Folks, 410 deaths and highest single-day spike of 19,906 new COVID cases in the last 24 hours have been reported in our country. That is a cause of worry. In fact, it's getting higher every time we talk about it, we report about it. Positive cases in India stand at 5,28,859, including 16,095 deaths. Recovery rates have overtaken active cases, and recovery rate has increased to 58.56%. In fact, that is some light at the end of the tunnel. And per day testing has crossed 2.3 lakh samples, and the difference in recovered and active cases has crossed 1 lakh as well. Now, announcing the move, Assam Health Minister Himanta Biswa Sarma said that, and I quote, "We are now left with no choice but to impose a complete lockdown for 14 days from the 28th of June, which is today. And this time it will be very strict, as no grocery shops will be allowed to open or supply of vegetables, and other essentials will be permitted for the first 7 days." Okay, we'll talk about this with our esteemed panelists on the show. Joining me on the program is Mudita Agarwal, Vice President of Delhi Congress, also joins me on the program. Dr. D.K. Gupta, CAP, also joins me on the program. All right, we have Dr. D.K. Gupta, who's the CMD of Felix Hospital. He's not a politician. He's somebody who's dealing with this situation, and he's grabbing the situation by the horns. He's perhaps not even interested in the politics that goes on, around COVID-19. Dr. Gupta, tell us, from a doctor's point of view, where has the state gone wrong?
Yes, so like we all know that this is a new virus and it was changing behavior rapidly, and we have very fortunate that we are attacked by this virus in little later period of time, and there were so many countries who have been already affected, and we have a lot of experiences and support from these countries. Even in India also, every state is not affected in a similar way, and the most of the larger cities are affected first, and now they are going to tier 2 and tier 3 cities. So there are a lot of experiences we are getting on this virus. But the lockdown was done for the two purposes. First, it was to break the chain of transmission. Second was to prepare ourselves for...
Okay, Dr. Gupta, let me amplify my question. Do you think that the lockdown worked or not?
It partially worked. It's not completely 30-40% worked, 60% was failure because of
it doesn't work.
Pardon?
Right? If it's 30-40%, it didn't work. You can't say the same thing about a corona medicine, right? If it works only 30-40% of the time, then it really doesn't work. So the lockdown did not work.
But 30-40% is not significant in the huge population of India. We have around 135 crore population. If we are implementing some strategy, it should be at least 60-70% implemented fully.
Okay, I give you
because of poor coordination between the central and state government, there are a lot of movement inside the whole country, and because of that, the virus has spread to our rural area. 70% of the population is residing in our rural area, and now it has moved to those areas, and we will see epidemic there in next 2 or 3 months, and it will have huge impact on this rural area. And now the other laborer again coming to the the bigger cities. They are now moving from the rural area to the major cities. So that's why the problem is that the one thing, because there was incoordination between the central government, state government, even there were lot of confusion between the local administration and the private hospitals, private players. There were so many orders, they were rolled back within the same day also.